over half of the population has not yet figured out whether they really need a neurosurgeon to begin with or a neurologist. The fact that the patients seek a pharmacist's help to solve their initial aches and pains clearly means, first of all, there is a reluctance to go and see a doctor.
Brain and nerve related problems create immediate fear in our families. But nowadays, people don't have to travel blindly without knowing more about their conditions right from the comfort of their own home. Through applications like UzuHealth and other teleconsultation platforms, people now have more power in their fingertips with their phones to understand more about what is ailing them and get a better understanding of their care before going for more complicated procedures and so on. So welcome. Today we have with us Dr. Akshat Kayal, consultant neurosurgeon at Kokilaben Ambani Hospital, one of the premier hospitals in Mumbai and also throughout India with us. And today we will be answering some questions related to how teleconsultation is changing access to neuro specialist care in India. Doctor, welcome to our podcast.
Thank you so much for having me.
Thank you. So, doctor, in neurosurgery, people immediately assume that they need to approach a hospital when there is something related to their brain or the neurological symptoms in general. Do you think that teleconsultation can be of any help in taking the first step for these families?
So, I think that teleconsultation does play an important role in screening out the patients who really need to approach the hospital for their initial consultation or for an immediate consultation. And a preliminary teleconsultation would actually help the patients achieve a clarity about whether their ailment is particularly a neurosurgical or a neurological one. So they can actually decide seeing a neurosurgeon over a neurologist or vice versa. And this is a very common occurrence that we notice, that the patient realizes that this is just a brain related problem or a spine related problem, and they club the entire thing into a very vague term such as neuro related problem. And there are fairly often times that I would be seeing patients who do not require a neurosurgical care on the instance when they had visited me. So probably having a teleconsultation early or prior to your consultation visit would make sense to at least screen the patients out who really need the care to be given at the center or at the hospital level, and at the same time the patient would also know whom to actually see, whether it is a neurologist or a neurosurgeon, when it is just a vague neurological problem to begin with.
Okay, doctor. So here I would like to ask you a particular question. Say that a patient is here in Assam, okay, and he wants to consult a neurologist back in Mumbai, okay, to you or to someone in your own hospital. How much can a doctor understand about the patient's condition from just an uploaded report or a scanned MRI copy?
This is a very nuanced problem that we face day to day. So most of the platforms and the way the images can be shared with the doctors in a teleconsultation has its own limitations. The patients usually do not have access to the technical images which give us the complete information about the pathology. And probably having a platform which can upload their images as they're supposed to be seen with a technical viewer to give us utmost amount of information would help the patients in sharing their investigations or diagnostic tests that have been done. Specifically when it comes to imaging modalities, it would be a really great, I think so, integration to have a teleconsulted or a televiewed imaging available to us over a platform. Now what usually happens is whenever we have a patient such as a patient who is trying to come and see us from a remote place, somewhere like in Guwahati, let's suppose, and prior to visiting to Mumbai, they just want us to have a quick peep at their scans that they have done over here. What would usually happen is the quality of images that they are able to upload is really very poor. And sometimes things are a lot more easier when we have the technical, the links to the servers which have the original images in place. That makes our job a little more easier. But most of the times it does so happen that we have half of the information that we really need to make a difference in giving a proper opinion to them. Also, a small problem that teleconsultation would always have is to have a clinical judgment of the patient. Now, the healthcare has actually moved on from clinical decision making to more of a diagnostic guided decision making process. And not having a patient available in front of you does makes a lot of difference, so as to make a judgment whether the radiological findings actually correlate with patient's problems. To give you an instance, the patient may just have some back pain and the radiological imaging may show that he has a disc prolapse. And if you just look at the scan, you may just end up suggesting him or her to go for a surgery. But when you examine the patient and you do not find any pains going down the leg, then it is pretty clear to you that you can manage it even conservatively. So I feel that teleconsultations are not able to bridge that gap. But nevertheless, with regards to the imaging, the question that you had asked, I think so it does make a lot of difference if the platform has a capacity to upload the images in a very high resolution. Yes, you're correct. Yes.
So then, doctor, in which cases related to neurosurgery would you think that teleconsultation would be suitable for? In what type of cases? Yeah,
so the majority of cases where we see patients taking teleconsultations with us in current scenario as well are usually second opinions. So first of all, the patients would have already visited a couple of doctors in their own vicinity or probably at other centers, and subsequent to that they want a tertiary healthcare center which has a high volume of work pertinent to that particular pathology to give an opinion as to what should be the right course of action. Now, when that kind of thing happens, it is pretty much easy for us to review all the reports and give them an answer. But whenever there is a new patient which onboards himself or herself for the first time to the doctor, telecommunication has its own limitation in terms of correct clinical judgment, and you have to rely on very heavily on history taking, because that is the only tool that you have. Probably you can do a few maneuvers if the patient is able to have a good one-on-one I would say video interface with you and try to judge a few clinical symptoms. But I think so that's mostly that we can actually achieve on a consultation platform as of now.
But like you said, if the patient is coming for a second opinion,
yes,
or if in such a scenario like there is a local doctor who's taking care of the patient and they connect with a doctor in a metropolitan city, in a tier 1 city having more advanced diagnostic care or neurological care, that situation would be more, I think, favorable for a teleconsultation based solution.
So
would you say that?
For a teleconsultation based solution, I think so, yes, it does make a sense that if the patient comes with a prior in-clinic consultation with one of the local doctors and has a detailed note of the consultation or the findings of the patient, and then we build upon that information to give a second opinion about the entire pathology that the patient is suffering from, then it actually makes far more sense. But nevertheless, there are situations wherein we end up being the primary consultants or the first consultants who are looking at the patients, and to a certain extent history taking and diagnostics do bridge that gap, but there is always a small iota of doubt if you have not examined the patient clinically yourself, that you have probably you are making the correct judgment for the patient at this point of time.
And would you say that when it comes to continuity of care, for example, let's say that the patient has consulted you directly for the first consultation, and the second consultation they want to do it via teleconsultation.
Yes.
Would you say that that situation would be more favorable for a teleconsultant, because then it will become easy for the patient
So
to
that is
also...
a very ideal situation for us. In fact, we rely on it pretty robustly as of today as well. So if, to give you an instance, if I have operated upon a patient who has done really very well, and I just need to review the scans every 6 months or every year, the telecommunication is the perfect platform for it. We hardly call our patients every 6 months to the hospital again and again, and save them travel costs and save them all the hassle of coming all over to another city. Just by doing a telecommunication or teleconsultation, you can actually bridge that kind of a gap. So I think so it works very well for patients who are previously well managed and have almost seen the completion of their treatment and are at a remission phase, who just need a constant surveillance and follow up to just for assurance, or probably sorting out some nitty-gritty problems which arise here and there.
Okay. Can you just tell us, in general, where do patients usually get confused before reaching a specialist?
So as I mentioned to you earlier as well, first of all, when it comes to neurosurgery, I would still say over half of the population has not yet figured out whether they really need a neurosurgeon to begin with or a neurologist to sort out their problems.
Could you please tell our viewers the difference?
So if it is a pathology which needs a surgical intervention, there is an established lesion or damage to a part of your brain or spinal cord which needs a surgical intervention, that is where a neurosurgeon's help is required. An ideal scenario would be to initiate your contact with a neurologist, which can actually screen it out for you whether you need to do a second consultation with a neurosurgeon as well. So most of the pathologies, if are to be managed, the escalation ladder of management is always medical to surgical. And most of the neurosurgical problems which can be managed medically at their early stages can also be seen by neurologists and treated by them. So I would say if your neurologist feels that this is a disease that he or she cannot help you with, then you should see a neurosurgeon. That is one. A scenario wherein you clearly know with your reports, or probably your general practitioner or your family physician has given you an advice to come and see a neurosurgeon, that would be then an ideal scenario to come and see a neurosurgeon.
Okay. So doctor, so we have over 2 decades of experience in the healthcare industry. So over the years of experience that we have, one of the most common issues that we see people face with is that they are not aware of which specialist to approach or what kind of doctor to approach.
Right.
Okay. So, so usually what happens in India is that, you have some kind of issue. The first point of contact is usually the pharmacist. Where you go to the pharmacy, you tell them that mera sar ka dard ho raha hai, or I'm having a stomach ache, or I'm having some sort of skin issue. And then the pharmacist gives them a solution, right? And when the medicine does not exactly solve the issue, when the problem further increases or becomes worse or becomes more complicated, only then do they start approaching hospitals or specialists or clinics. So do you think that platforms like UzuHealth, which allows people to have an initial consultation with a health expert and get an idea whether their issue requires immediate medical attention or not, and what type of specialist to approach, do you think platforms like that have any will they see any benefits for people in India, especially when it comes to specialist access?
Definitely so. So you need to understand, as you have yourself stated the problem, and I see the solution of the problem lying in the problem itself. The fact that the patients seek a pharmacist's help to solve their initial aches and pains clearly means first of all, there is a reluctance to go and see a doctor just for a consultation. It could be a financial reluctance, or it could be just a sheer reluctance or an attitude of being dismissive about the disease process itself, thinking that it is a trivial problem which would get sorted out. And that is when they actually approach the pharmacist. Now, in order to divert them from seeing a pharmacist and doing a teleconsultation or an, I would say, in-person consultation in a clinic, is practically the same problem. You won't have a solution to either of the two. To motivate them to do a teleconsultation, which would be far more easier for them, sitting at their home, they can take a quick opinion and then go to the pharmacist with the prescription. But again, it takes a certain amount of initiative from the patient's end to approach either the teleconsultation platform or the doctor in the clinic. So I would suggest, like, if you are specifically focusing on the problem of the patients directly visiting the pharmacist, a teleconsultation platform like yours, which can be placed at a pharmacy, would actually sort out most of the problems.
Thank you for saying that. That is one of the solutions that we are providing. So we provide a free screening service where we understand the patient's symptoms and we refer them to specialists who can actually help them solve the issue further or take it forward. So doctor, I'm sure like throughout your medical profession, you have encountered a lot of problems that people have faced. So what would you say is the most common problems that you have seen in patients that you think can be easily solved?
Can you elaborate the question in terms of?
Yes. So can you tell us about like what is the type of problem that you see most common in patients that that, or mistakes rather, not problems exactly, mistakes that patients make when it comes to taking appropriate steps to their care?
So first of all is a casual attitude usually, and relying too heavily on home remedies. I would not dismiss them off altogether, but when home remedies or an odd pill that you have taken from your pharmacist is not helping your troubles go away, or the problem is still persistent as well as it is worsening, the hesitation to come and see a physician is the biggest hurdle that I would say. The second problem that they face is usually seeing the right physician. They are most of the times clueless whether to see a particular specialist over the other. And in that framework, I think so, the community physicians or the family physicians play a very major role to give them a correct direction or guidance, as well as motivate them to seek further help. And then secondly, if there is an accessible, I would say, platform, online digital platform, with which they do not even have to step out of their homes and can have a online consult with a general physician who can further guide them down to see a particular specialist for their problems. I think so these are the few problems and probably the solutions to them that I can think of as of now.
So doctor, according to you, the ideal way that a person, the normal person, should solve these kind of issues is that they should first approach general physicians, and that general physician should refer them to a specialist.
Yes. See, you would have observed the healthcare has actually transformed in the last 2 decades. It has compartmentalized itself into specialities and subspecialities. So, for example, within the neurosurgery, there are some 7 to 8 different subspecialties of neurosurgery. There is spine surgery, vascular neurosurgery, trauma, there is neuromodulation or functional neurosurgery, epilepsy surgery, and so on. Now, whenever a patient is trying to seek help for a pertinent neurosurgical problem itself, today with the access to healthcare setups like ours or any other tertiary healthcare setups that are available, as well as the spectrum of expertise that the doctors have within the same specialty or a super specialty, if they are guided better by their family physician or by a platform, by looking at their symptoms, that you need to see a specific subset of neurosurgeons or a neurosurgeon who has an expertise in a particular field. That would actually make more sense for the patients, and it would save them at least 2 or 3 unnecessary consultant visits to doctors who are probably not, I would say, well equipped to sort their problems.
So, Dr. Akshat, we have come to the end of our conversation. It was lovely talking to you. And I would love to pick your brain for more information, both about neurology and as well as medicine in general. So, I hope you enjoyed your first time on our podcast, and I would love to have you on board for more sessions in the future.
I really loved talking to you. It was a pleasurable experience, and hopefully we meet again.
Thank you. Thank you
Thanks
so
a lot.
much.